For straightening in the legs with achondroplasia, why is the method used sometimes what's called 8 plates or guided growth, sometimes osteotomy with permanent plates, and sometimes the big rings that go around the outside of the legs, the external fixation devices, well, like that. It's like some people call them halos, some cages. Is one of these methods better or safer than the other? So those are 3 methods of straightening a leg. One is guiding the growth of the leg. Second is acutely or all of a sudden making the leg straight by cutting the bone and fixing it with some type of device. It can be internal rods or plates. It can be external, and your leg's straight automatically as you leave the OR. Or you can put on devices that gradually straighten your legs, and these are usually external fixation devices. We don't have reproducible, predictable, or gradual internal devices at this point to straighten legs. It depends on the age. Guided growth is just that. You have to be growing. In the years past, the types of devices that very small implants we put around the growth plate were not thought to be viable in patients whose growth plates have an underlying growth difference or a dysplasia. Dr. Peter Stevens from Utah had developed the original, what we call the 8 plate. There's multiple different forms and shapes of this type of device now in the market that gradually improve the alignment with growth. And he has shown that even severe deformities can possibly be addressed and corrected in this way. And so if a patient is not symptomatic with their deformity, they're growing, and they do not wish to increase the length of that bone segment with deformity correction, then an 8 plate is a very viable option, very easy, meaning day surgery, and there's no drawbacks to it. The disadvantages, I think, of the guided growth type surgery is that it's not guaranteed that the growth might not correct the deformity, could improve it but not correct it completely. And you still might have to perform other surgeries. You're not going to gain length from guided growth as far as distraction, histogenesis, or osteogenesis, making bone. But it's definitely, if you are a 5, 6, even 7-year-old patient with significant bow legs, knock knees, things of that nature, and if it's not symptomatic, then there's very little downside of trying to straighten the legs with these devices. I think the acute osteotomy with plating or rodding or external fixation is really kind of relegated to very severe deformities that are very symptomatic, and you don't have the luxury of time because the 8 plates happen over months, 8 months, 12 months, 18 months of growth. So if you have a severe deformity and you're symptomatic, then you would want the leg straight faster. The gradual correction is for extreme deformities that even making the leg straight in the operating room would create too much of a risk for the soft tissues around the bone, the nerves, the blood vessels. Then the gradual distraction correction with an external fixation is the best. And you can also add length. And so I think it depends on the patient's goals and expectations. They can all be very safe. It just depends on the age, the severity of the deformity, and what are the goals.